Hi, good morning. I'm Colin McConsky. I'm the invigilator here for the OET speaking test, April 4th, 2020. May I know your full name, please? Hi, good morning. My full name is Benjamin Smith. Can I have your passport, please? Yes, sure. Here it is. Can I have your candidate number, please? My candidate number is 6518224. All right. Now, we shall start our warm-up session. How will you contribute your professional experience in a developed country, for the betterment of your country? I have learned in my childhood about the benefits of sharing knowledge. Knowledge gets multiplied when we share it with others. I would like to take the role of a nursing tutor, when I return to my home country, after several years. It will be the best job role I can possess to share my experience and knowledge. I believe that I can do my best in the teaching job role. It will be beneficial to the aspiring young nurses of my country, reflecting a better healthcare environment to society. Will you support your child to become a nurse? Yes, sure. Nursing is not just a profession. Nurses are lifesavers, serving the society in any circumstances. It is one of the most respected job, and possesses dignity. Smile of a patient and their family, when they leave hospital after curing the disease, is very much satisfying and proud moment. It is also emotional when we can't achieve the result even after doing the best. Comment your views on the salary for nurses in your country. Our government and health authorities have taken the necessary steps to provide good salaries to the nurses. They have made it compulsory that a minimum amount should be paid to a registered nurse. Nurses under the government sector are getting good salaries and other benefits. However, nurses in the private sector are still suffering to get paid a good amount. Even though, most of the private hospitals are still paying fewer wages to the nurses. Tell me the 3 points you will raise, if you get a chance to meet the health minister of your country. It will be a proud moment for me if I get a chance to meet the health minister of my country. I will thank him on behalf of all nurses for taking very good decisions at the right movement in the time of the pandemic. The 3 points I'll raise are: first, definitely, I'll ask for the proper implementation of wages of the nurses both in the private and public sectors. Second, protection of all healthcare workers. In some parts of the country, the medical staff was attacked brutally without understanding the scenario. Third, nurses should be provided with proper benefits and free insurance as they are sacrificing their lives for the welfare of society. Is continuing education necessary for nurses? Continuing education is necessary and plays a vital role in the development of the health department in a country. Many of the hospitals are conducting seminars and classes for the nurses occasionally. However, in many countries continuing education is compulsory and mandatory for license renewal and many other registration processes. Okay, so that's the end of the warm-up session. We shall move on to the task question. I can help you out with the task card. You have 3 minutes to prepare and further you can start on. So, the preparation time is up now, you can start role play. Hello, my name is Stuart. I am going to be your emergency room nurse today. May I know how I can address you? You can call me Susie. Okay, I find a burn injury on your forehead. Is that right? Yes, I am in a lot of pain. I can realize it is hurting you. For pain, I will provide you with some pain medication and some management for your wound as well. Before that, if you don't mind, could you please tell me how it happened? Oh. Yes. I was getting ready to go out with friends to a party, and I was curling my hair, using the hair curling iron. At the same time I was paying attention to my favorite TV show. I know it happened because of my carelessness and I should have been more careful. I am sorry for you. May I know how you responded to it? Have you applied anything on the burn area? Yes, some time ago, I read online that using a cold compress, over a burn will give relief. So suddenly after the incident, I applied the cold towel over the burnt area, but still, I was in pain and, as per my friend's advice, I rushed to the hospital. Good. That was a timely action. If you have left the burn area unattended for too long, it could have led to an infection. Shall I know, have you taken any painkiller at home? No, it was an extreme pain, so that is the reason why I ran into this hospital. All right. No worries. Now, I'll give you an injection for pain relief, and then we'll clean the burnt area and apply an antibiotic ointment to prevent any infection. Later, I will cover the burnt area with a band-aid for skin protection. I will provide you with painkillers. In case of pain at home, it will aid you. Thank you. Well, I'm very much concerned about the scar. It would be weird if it left a scar. I can understand your concern about scarring. But at present, you need to be more conscious about burn care. A proper burn care is essential for the overall healing and to prevent further infection. Do you agree with me? Yes, I do agree with you. But you see, I am an aspiring model. And it can really ruin my career if I get scar on my face. I understand your situation and it's reasonable too. I can provide you with a few tips that you can do at home to improve the healing process and minimize the scarring. Can you spare a few minutes to listen about it? Sure, of course, with pleasure. You may proceed. The prior importance is to keep the wound clean and dry. Moisturize your skin daily and keep the area covered with a skin protectant. Use sunscreen for protection against UV rays. Aloe vera gel without any additives is good for soothing. Would you be able to do this? Yes, I will try to follow it. That's great. Moreover, it's essential to have a nutritious diet, which is rich in protein, and make sure that you drink adequate amount of water to remain hydrated. Yes, I can follow it. But please tell me about scarring. I am anxious about it. Okay. Don't worry about it. First of all, make sure that you do not pull out scabs over the wound that may cause scarring. Try to maintain the area moisturized and properly cover the area, which would allow the new skin cells to grow quickly and to maintain the elasticity. The appearance of scars will improve over time as it matures. Do you have any further questions? Could you please tell me the exact time required for the scar to fade away? Yes, I know you are anxious about this. Don't worry, it will fade away to a greater extent in a few weeks. But for that, you should apply moisture and sunscreen regularly. Then only the skin's natural regeneration process takes place smoothly. Furthermore, if you want to come out of scars completely, there are many cosmetic treatments and products available in the market nowadays. Could you please tell me about those? Because I don't want any mark on my face. Sure. For best advice on such options, I can refer you to a dermatologist, who will be able to offer different solutions for reducing the scarring. However, you would need to wait until the burn gets completely cured. I hope that's okay with you? Yes. So, how much time would it take for the burn to heal completely? Well, it might take between 3 to 6 weeks to heal. In the meantime, you should be careful about the burnt area for any infection. If you find any chances of infection such as swelling, redness, or exudates, kindly reach us immediately. Yes, I understand. Now, I am going to clean the affected area and apply an ointment. Then cover it with a gauze. Please keep in mind that you need to be back in 2 weeks, so that I can have an assessment on the wound. I hope you can make it. Yes, absolutely. Good to hear, Susie. As we discussed earlier, I'll schedule the appointment with the dermatologist once your burn has healed. Don't worry about your carrier. I can assure that the dermatologist can provide good treatment for the scar. Okay, that sounds great. I will wait until complete recovery from the burn and then consult a dermatologist about it. Thank you. You're very welcome. See you in 2 weeks. Take care with proper medications. So, that's the end of your OET speaking test. Thank you. Thank you, sir.
Thank you for watching. Please Like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.